to episode 8 of our COVID-19 and Engineering series exclusively from our AHAR Consultants YouTube channel. For this episode, we will review a case study on COVID-19 outbreak at a call center in South Korea and how it was managed with good diligence to prevent further transmission of the disease. You may check at Centers for Disease Control and Prevention (CDC) website for further details on this case study. From that case study, we will discuss how a single outbreak in a crowded office setting should change the way we carry out health and safety measures in office workspace. Without further ado, let us dive into the episode. On March 8, 2020, the Seoul Metropolitan Government was notified of a confirmed case of COVID-19 in a person who worked in Building X. Building X is a 19-story building located in the heart of Seoul. Commercial offices located from floors 1 to 12 and residential apartments are located from floors 13 to 19. The call center in discussion is located in floor 11. The Seoul Metropolitan Government has identified a total of 1,145 patients under investigations, PUI. Of the 1,145 PUIs, 992 were employees working in the government commercial offices, 203 were residents of Building X, and 20 were visitors who had been to Building X weeks prior to the outbreak. Immediately after the outbreak was reported, Building X was closed on the 9th of March 2020. The Korean CDC had tested all occupants of Building X from 9 to 12 March. Of the occupants tested, confirmed case patients were isolated and negative case patients were mandated to stay for home quarantine for 14 days. During March 13 to 16, a total of 16,628 text messages were sent to people who are staying within 5 minutes of Building X. The message instructs people to avoid contact with one another and go to the nearest COVID-19 screening centers to get tested. Of 1,145 PUIs, only 1,143 were tested. And out of that 1,143, 97 people, or 85%, were confirmed cases. What's interesting about this is that 94% or 97% of the confirmed cases were employees working on the 11th floor call center, which had about 216 employees in total. Despite considerable interaction between workers on different floors of Building X, such as in the elevators or in the lobby, spread of COVID-19 was limited to almost exclusively to the 11th floor call center. Nearly all cases of all positive cases were on one side of the building on the 11th floor, as highlighted in blue. Residents and other employees in Building X had frequent contact in the lobby and elevators, but neither got infected. This outbreak exemplifies the threat posed by COVID-19 with its propensity to cause large outbreaks in office workspaces. This shows alarmingly that COVID-19 can be exceptionally contagious in crowded office settings. The magnitude of outbreak illustrates how a high-density work environment can become high-risk site for the spread of COVID-19. The duration of interaction is likely the main facilitator for further spreading of COVID-19. Targeted preventive strategies might help mitigate the risk for COVID-19 infection in these vulnerable groups. This infographic was published by Bernama may help employers to ensure the safety and health of their employees in office workspaces. In a nutshell, the epidemiology of COVID-19 indicates that most infections spread through close contact rather than airborne transmission. However, circumstances under which airborne transmissions of COVID-19 appears to have occurred includes, number one, enclosed space where an infectious person either exposed themselves to people at the same time, or people coming into the enclosed area after the infectious person has left the space. Number two, prolonged exposure to respiratory particles often generated by expiratory exertions like singing, shouting, that increase the concentration of suspended respiratory particles in the air. And lastly, number 3, inadequate ventilation or air handling that allowed a buildup of suspended respiratory droplets and particles in the area. In conclusion, crowded offices and workspace and poor ventilation or air handling are just recipes for disaster. Therefore, it is very important that people start implementing targeted preventive measures or strategies to ensure the safety and health of workers in workspaces. That will be all from me. We hope that this sharing session will benefit people and create awareness on the necessary actions to be taken to combat this virus. If you find this video helpful, be sure to hit the thumbs up below. If you are new to the channel, be sure to subscribe, turn on notifications till we meet again on the next episode. Bye bye.